You know, when you see statistics like cancer being responsible for 20% of all deaths in the U.S.,
Yeah.
um,
Yeah.
it's a big number. Like that
Yeah.
really hits you.
It does.
But then you dig deeper, like we did with the material you shared,
Mm.
and you see that more than half of the people who develop cancer are actually cured.
Right.
So it's like this huge reminder of how serious it is,
Yeah.
but also this beacon of hope. It's
Yeah.
like, wow, it's so serious,
Right.
but there's so much progress being made.
Exactly. And I think that's the crucial balance that we have to keep in mind.
Yeah.
The prevalence is undeniable,
Yeah.
but at the same time, the curability is increasing.
Yeah.
And I think that's what makes gaining a solid understanding of what cancer is so important.
Yeah.
Because it's not just one disease.
Right.
It's a whole spectrum. And the outcomes can vary.
Yeah, absolutely. And that's what we're doing in this deep dive, go through all the information that you've given us, really
Yes.
getting to the heart of what cancer is.
Absolutely.
How it starts,
Yeah.
how it's detected,
Right.
how it's treated,
Yep.
and really giving you a strong understanding of all of that based on what you've shared.
I like to think of it as like extracting the essential insights from the materials that you've shared with us.
Yeah.
Because it's a very comprehensive overview of this very complex topic.
Right.
And we're going to do our best to kind of highlight the things that stand out and
Yeah, give a clearer picture
yeah,
without getting bogged down
right.
in the overly technical.
Exactly.
So,
Yeah.
what is cancer at its most basic level?
So at its heart, it's characterized by uncontrolled growth of cells.
Okay.
But it's also important to understand that a cancer diagnosis isn't a single fixed outcome.
Right.
How things progress depends on several key factors.
Yeah.
The specific type of cancer involved,
Uh-huh.
how far it has developed by the time it's found,
Okay.
and how the individual's body responds to available treatments.
Right. So it's very much an individualized thing.
Very much so.
Okay. And this process of a normal cell transforming into a cancerous cell, that's called carcinogenesis, right?
That is correct.
So tell me about that.
So carcinogenesis is this step-by-step process
Okay.
where a normal cell undergoes a series of changes
Mm-hmm.
that ultimately transform it into a cancerous one.
Okay.
It often involves multiple factors
Uh-huh.
acting over a period of time,
Okay.
which we'll explore in a bit.
Okay. So we have these normal cells,
Right.
and they start behaving abnormally for various reasons.
Right.
And we see and hear that there's this distinction between benign and malignant tumors.
Right.
So what's the key difference there?
So while both involve cells growing and multiplying more than they should,
Okay.
benign and malignant tumors have fundamentally different behaviors.
Yeah.
So one way to think about it is in terms of speed.
Oh,
So malignant tumors tend to grow rapidly,
Yeah.
like a fire spreading quickly,
mm-hmm.
whereas benign tumors grow much more slowly,
Yeah.
more like a slow leak.
Got it.
So that's one major difference.
Okay, so rapid versus slow. So that kind of gives you an idea of right away which one's more dangerous potentially.
Right, exactly.
What else sets them apart?
So another key difference is invasiveness.
Okay.
Malignant tumors are invasive, meaning they can actually infiltrate
Yeah.
and destroy surrounding healthy tissue,
Okay.
like roots growing and damaging the surrounding soil.
Uh-huh.
Benign tumors, on the other hand, are typically encapsulated,
Okay.
meaning they tend to stay contained within a defined boundary,
Okay.
like a self-contained bubble.
So one stays put and the other spreads out and damages things around it.
That's a great way to put it.
Okay.
Yeah.
And you talk about the
Yeah.
cells being undifferentiated or differentiated.
Yes.
What does that mean?
So this refers to how specialized the cells are.
Okay.
So in benign tumors, the cells are usually well differentiated.
Okay.
They still look and act somewhat like the normal cells they originated from.
Ah.
They still have a specific job to do.
Okay.
Whereas in malignant tumors, the cells are often undifferentiated.
Ah.
Or poorly differentiated.
Yeah.
They've kind of lost many of their original characteristics,
Okay.
and they don't function in the same specialized way.
So I'm guessing that undifferentiated is worse.
Exactly, because they're less like normal cells.
Yeah.
They often behave erratically
Mm-hmm.
and contribute to the harmful effects of the cancer.
Got it.
And then finally, and perhaps the most critical difference, is the ability to metastasize.
Right.
So malignant tumors can spread to distant parts of the body.
Hmm.
They can travel through the bloodstream or the lymphatic system
Right.
and establish new tumors in other organs.
That's a big worry
Exact.
when it jumps from one to another.
Right.
Okay, so to recap quickly.
Yeah.
Benign is slow growing,
Right.
stays in one place.
Correct.
And the cells look like normal cells.
Yes.
Malignant is fast-growing, invades surrounding tissues.
Right.
The cells look less like normal cells.
Yes.
And it can spread to other parts of the body.
You got it. That's a really clear summary.
Yeah, that's right.
And these fundamental differences are what dictate how we approach treatment and what the potential outcomes might be.
Okay, so now we know kind of how the cells are different
Right.
in these two types of tumors.
Right.
Why does this abnormal cell growth start happening in the first place?
So it often begins with damage to the genetic material within the cell.
Okay.
So we're talking about DNA, genes, nucleotides.
Okay.
Think of DNA as the cell's instruction manual.
Uh-huh.
So damage to this manual can lead to mutations,
Yeah.
which are permanent changes in the DNA sequence,
Okay.
like a typo that changes the meaning of a crucial instruction.
Yeah, so it's a critical error in the cell's operating system.
That's a great analogy. And sometimes these typos affect crucial processes like apoptosis,
Okay.
which is programmed cell death.
Uh-huh.
So normally if a cell is damaged
Right.
or behaving abnormally, it has a built-in self-destruct mechanism.
Yeah.
But in cancer, this mechanism often fails.
Right.
So the faulty cells don't die when they should.
So they keep living and making more faulty cells.
Exactly.
Yeah.
And to make matters worse,
Yeah.
the normal processes of mitosis or cell division,
Uh-huh.
which is how cells make new copies of themselves,
Right.
and protein synthesis,
Oh.
which is how cells build the molecules they need to function,
Yeah.
those can also become disrupted,
Uh-huh.
leading to that uncontrolled multiplication we talked about earlier.
Okay, so genetic damage,
Right.
mutations,
Yeah.
a broken self-destruct button,
Yeah,
and messed up cell division and protein making.
that's a great way to summarize it.
Okay, that gives a really good picture of what's going wrong inside.
Right.
But what are the external factors
Yeah.
or internal factors, I guess,
Right.
that can cause this damage or these mutations?
So carcinogenesis, that process of a normal cell becoming cancerous,
Right.
can be triggered by a wide array of factors.
Okay.
Your materials really helpfully categorize these. So first we have environmental and chemical carcinogens. Things like certain chemicals,
Yeah.
asbestos pollutants,
Yeah.
things we might be exposed to
Right, in our daily life.
in our daily life
Blood
or
in the family.
workplaces.
Yeah.
And then there's radiation
Right.
from sources like UV rays or medical treatments,
Okay.
which can damage DNA.
Uh-huh.
And interestingly, viruses,
Oh.
both RNA and DNA viruses,
Okay.
are also implicated in the development of some cancers.
Really? Viruses?
Yeah.
I don't usually think of that.
Yeah, it's not the first thing that comes to mind.
No. Usually I'm thinking about like the flu,
Right.
some kind of infection.
But what happens is some viruses,
Yeah.
they can actually insert their own genetic material into our cells.
Wow.
And this integration can sometimes disrupt the normal control mechanisms of cell growth.
Right.
And that can potentially lead to cancer.
Okay, so environmental factors, radiation, certain viruses.
Uh-huh.
What about oncogenes? Those are kind of mysterious sounding.
They do sound a bit sci-fi.
Yeah.
But oncogenes are actually altered forms of normal genes called proto-oncogenes,
Okay.
which have the potential to cause cancer if they become activated by a mutation or some other genetic alteration.
Okay.
So think of proto-oncogenes as genes that normally regulate cell growth and division,
Uh-huh.
but if they get switched into a permanently on state,
Oh, wow.
they can drive uncontrolled cell proliferation.
Okay, so if the switch is flipped in the wrong direction,
Exactly.
things can go haywire.
Yeah.
And there were some really specific examples in here, like the ROS gene in colon cancer,
Right.
myelotaphic in lymphoma,
Mm-hmm.
BCR-ABL in chronic myelogenous leukemia.
Yeah, those are just a few examples.
Those are really good examples because they're so specific.
Yeah, and they illustrate
Yeah.
how specific genetic changes can be directly linked to the development of particular types of cancer.
Yeah.
And they've even led to the development of targeted therapies,
Wow.
which is really exciting. And then finally, heredity also plays a significant role. Some individuals inherit specific gene mutations from their parents
Right.
that increase their susceptibility to certain cancers.
So it can run in the family literally at a DNA level.
Right.
And talked about retinoblastoma polyposis coli syndrome,
Mm-hmm.
breast colon, and kidney cancers
Those are just a few examples.
as all being examples of hereditary cancers.
Right, and it's important to note
Yeah.
that inheriting these genes doesn't guarantee that a person will develop cancer.
Right.
It just means they have a higher risk.
Yeah, a predisposition.
compared to someone without those specific genetic predispositions.
Okay, so we have a good grasp, I think, now of what cancer is
Yeah,
and what causes it or what the factors are that contribute to its development.
right.
Now, how do doctors categorize cancer?
Right, because there are so many different types.
Yeah, like a zillion types.
There are many different types, and they're broadly classified
Yeah.
based on the type of tissue from which they originate. So your materials outline 4 main categories.
Okay.
So first we have lymphomas,
Okay.
which are cancers that arise in the infection-fighting organs of the body,
Okay.
primarily in the lymphatic tissue.
So these are cancers of the immune system itself?
Yes, precisely.
Okay.
Then there are sarcomas,
Uh-huh.
which are cancers that develop in the body's connective tissues,
Okay.
such as bone, muscle, cartilage, fat.
Yeah.
It's worth noting that sarcomas are relatively rare
Okay.
compared to other types of cancer.
Uh-huh.
They account for only about 5% of all malignant tumors.
Okay, so lymphomas in the immune system,
Right.
sarcomas in more of the structural tissues.
Yeah, the connective tissues.
Okay. What are the other ones?
So the most common category, making up around 90% of all malignancies, is carcinomas.
Wow.
These are cancers that originate in epithelial tissue,
Okay.
which forms the lining of most of the surfaces in the body, both external and internal. So this includes the skin, the lining of glands, the lining of the gastrointestinal tract, the lungs, and the reproductive organs.
Wow, so 90% are carcinomas.
Yeah, that's a huge proportion.
That really highlights how common
Yeah,
cancers of these lining tissues are.
right.
Okay, so carcinomas, and the last one.
And then finally, we have mixed tissue tumors.
Okay.
These are cancers that arise from tissues that are capable of differentiating into both epithelial and connective tissue.
Okay.
Examples of these can be found in organs like the kidney, ovaries, and testes.
Okay, so the classification really depends on where the cancer first takes hold.
Right.
What type of cell goes awry.
Exactly.
Okay, that makes sense.
Yeah.
Now, what are the factors
Yeah.
that increase a person's risk of developing cancer?
So your sources provide a really comprehensive overview of risk factors,
Yeah.
and it's helpful to think of them in different categories.
Uh-huh.
So first we have environmental factors,
Okay.
which play a significant role. So exposure to substances like asbestos, certain industrial chemicals, cigarette smoke, other occupational hazards.
So these are things in our surroundings or workplaces.
Right.
Yeah,
Things we
yeah.
might come into contact with.
Yeah.
Then we have lifestyle factors,
Okay.
many of which are within our control.
Uh-huh.
These include things like tobacco use,
Right.
excessive exposure to ultraviolet radiation from the sun,
Okay.
alcohol consumption, and dietary habits.
Those are the things we always hear about in terms of prevention,
Exactly.
making healthy choices.
Absolutely.
Okay.
Genetic factors, as we discussed,
Yeah.
with inherited predispositions,
Yeah.
also contribute to risk.
Yeah.
So a strong family history of a particular type of cancer can indicate an increased likelihood for an individual to develop it.
Right.
And then lastly, viral factors are increasingly recognized.
Right.
While the exact role is still being studied,
Uh-huh.
certain viruses have been linked to an increased risk of developing specific cancers.
So it's a complex interplay of what we're exposed to, how we live our lives,
Mhm.
our genetic makeup, and even certain infections.
It really is a multifactorial disease.
It is okay now.
Yeah.
Once there's a suspicion of cancer,
Right.
how do doctors determine the extent of the disease?
Okay.
I know I saw in here staging and grading,
Yeah.
so tell me about that.
So staging and grading are essential for understanding
Okay.
how far a cancer has progressed and how it might behave.
Okay.
So staging is primarily about determining the extent to which the cancer has spread within the body.
Okay.
It helps doctors assess the size of the original tumor,
Mm-hmm.
whether it has spread to nearby lymph nodes
Okay.
or to distant organs, which is metastasis.
Right. And this material mentioned the TNM classification system.
Yes, so TNM is a widely used staging system
Okay.
where T stands for tumor
Uh-huh.
and describes the size and extent of the primary tumor,
Okay.
N refers to node,
Yeah.
and indicates whether the cancer has spread to nearby lymph nodes. And
Okay.
M stands for metastasis. Uh-huh.
And tells us if the cancer has spread to distant parts of the body.
Got it.
And these TNM categories are then combined to assign an overall stage,
Okay.
often represented by Roman numerals I through 5,
Right.
with higher stages generally indicating a more advanced disease
Right.
and a potentially less favorable outlook.
Okay, so staging is the roadmap
Yeah.
of where the cancer is located and how far it's spread.
Exactly.
Okay, what about grading?
So grading, on the other hand, focuses on the characteristics of the cancer cells themselves,
Okay.
as viewed under a microscope.
Uh-huh.
It's based on the degree of differentiation,
Okay.
how much the cancer cells resemble the normal cells from the tissue where they originated.
Okay.
So tumors are typically graded on a scale from I to IV,
Uh-huh.
with higher grades suggesting a more aggressive tumor that is likely to grow and spread more rapidly.
Yeah, so a higher grade number means more aggressive.
Exactly.
Okay.
So well-differentiated cells,
Yeah.
which retain more of the characteristics of the original tissue.
Yeah. Are generally associated with lower grade tumors
Okay.
and a potentially better outcome.
Okay, so staging tells us how far it's gone,
Right.
and grading tells us how aggressive the individual cancer cells are.
That's a great way to put it.
So staging is location and spread.
Mm-hmm.
Grading is how nasty the cancer cells look
Yeah, how aggressive they appear.
under the microscope.
Exactly. And both are really critical pieces of information
Yeah.
that guide treatment decisions and help provide patients and doctors
Yeah.
with a better understanding of the likely course of the disease.
Got it. Okay, so if cancer is suspected,
Yeah.
how is it actually diagnosed?
Right.
What tools are available?
So the diagnostic process involves a variety of tools.
Okay.
So first, we have diagnostic imaging techniques.
Okay.
Things like X-rays, CT, scans, MRI, ultrasound. These play a vital role in identifying tumors, masses, cysts, or other abnormalities within the body.
Right, so these are all ways to see what's happening inside.
Exactly. They allow us to visualize the internal structures. Yep.
And then we also have bone scanning,
Okay.
which uses a small amount of radioactive material to highlight areas of tumor growth or other abnormal bone activity.
Oh,
And then there's endoscopy,
Right.
which allows doctors to directly visualize internal organs and tissues
Yeah.
by inserting a thin, flexible tube with a camera attached,
Yeah.
either through natural body openings or small incisions.
Right. So those are all ways to visualize
Right.
what's happening.
Uh-huh.
But I remember it saying in here that there's one method that provides a definitive confirmation.
Yes, you're absolutely right.
Okay.
A biopsy is the only way to definitively diagnose cancer.
Okay.
So this involves taking a small sample of tissue from the suspicious area
Mhm.
and then examining it under a microscope by a pathologist
Okay.
to look for the presence of malignant cells.
So imaging and scopes can give indications.
Right. Strong suspicions.
Yeah. But the biopsy gives the proof.
It's the gold standard.
Okay. And there were some lab studies mentioned in here too.
Things like alkaline phosphatase, CEA, PSA.
Uh-huh.
What are those for?
So these are known as tumor markers,
Okay.
which are substances that can be found at elevated levels
Okay.
in the blood, urine, or other body fluids in the presence of certain cancers.
Uh-huh.
So, for example, alkaline phosphatase, or ALP,
Yeah.
is an enzyme normally present in the body,
Uh-huh.
but elevated levels in adults can sometimes indicate the presence of metastatic tumors in the bone,
Okay.
often originating from cancers like breast or prostate cancer.
Uh-huh.
The normal range is typically between 30 and 120 units per liter.
Okay, and serum calcitonin was another one.
Yes, so serum calcitonin levels are primarily used to help diagnose and monitor medullary thyroid carcinoma,
Yeah.
a specific type of thyroid cancer.
Got it.
And many individuals with this condition will have elevated calcitonin levels,
Okay.
even when their blood calcium levels are within the normal range.
So a marker specific for a type of thyroid cancer.
Right.
What about CEA?
So CEA stands for carcinoembryonic antigen. It's a protein that can be elevated in various cancers,
Okay.
particularly gastrointestinal cancers and breast cancer,
Uh-huh.
but also in some non-cancerous conditions.
Okay.
So while it's not a perfect screening tool,
Right.
it can be helpful in assessing the prognosis of certain cancers
Okay.
and monitoring a patient's response to treatment.
Uh-huh.
Normal levels are generally below 5 nanograms per milliliter.
Okay, and then PSA.
Yes, PSA stands for prostate-specific antigen.
Right.
It's a protein produced by the prostate gland.
Yeah.
And elevated levels can be a sign of prostate cancer,
Okay.
but also benign conditions like an enlarged prostate or prostatitis.
Right.
So it's a valuable tool
Yeah.
for both detecting and monitoring prostate cancer.
Uh-huh.
The normal range is generally considered to be below 4 nanograms per milliliter,
Okay.
though this can vary based on age and other factors.
Right, so an elevated PSA doesn't automatically mean cancer.
Exactly. That's an important point.
Yeah.
It's just one piece of the puzzle.
Okay, and then CA 125.
So CA-125 is a protein
Uh-huh.
that is often elevated in women with ovarian cancer.
Okay.
Again, it's not a perfect screening test
Uh-huh.
because other conditions can also cause elevated levels,
Right.
but it's a useful marker for monitoring treatment response
Okay.
and detecting recurrence in women who have been diagnosed with ovarian cancer.
Okay.
Normal levels are typically between 0 and 35 units per milliliter.
Okay. And the last one was stool examination for occult blood.
Right, so that test is designed to detect blood in the stool
Yeah.
that isn't visible to the naked eye.
Right.
It can be an indicator of various conditions,
Uh-huh.
including both benign and malignant tumors in the gastrointestinal tract,
Okay.
as well as other issues like ulcers or inflammatory bowel disease.
Right.
A normal result is negative for occult blood.
So these tumor markers aren't like
You're right.
the be-all, end-all.
They're not definitive diagnostic tools on their own.
Yeah.
They provide important clues
Oh.
that doctors use in conjunction with other tests.
puzzle.
Exactly.
Okay, so now we know how it's diagnosed.
Right.
How is it treated?
So your materials outline a range of treatment modalities.
Sure.
So first we have surgery, which remains one of the oldest
Yeah.
and most frequently used approaches.
Uh-huh.
It can be curative, aiming to completely remove the tumor.
Right.
It can be palliative to relieve symptoms and improve quality of life
Oh.
when a cure isn't possible.
Yeah.
Or it can be reconstructive to restore function or appearance after cancer treatment.
So surgery is often the most direct way to just remove the cancer.
It's a physical removal of the tumor.
Okay, what about radiation therapy?
So radiation therapy uses high energy rays,
Okay.
such as X-rays or gamma rays, to damage the DNA of cancer cells,
Uh-huh.
ultimately leading to their death.
Okay.
The goal is to target the cancer cells
Right.
while minimizing damage to the surrounding healthy tissues.
Okay.
It can be delivered externally, where a machine outside the body directs radiation towards the tumor,
Okay.
usually on an outpatient basis,
Uh-huh.
with careful shielding to protect healthy areas.
Got it.
Or it can be delivered internally,
Okay.
where radioactive materials are placed directly inside the body near the tumor,
Okay.
using devices like wires, seeds, or catheters.
Okay.
Internal radiation is often used for cancers of the tongue, lip, breast, and other specific sites.
Okay, so with surgery, we're physically removing it.
Right.
And with radiation, we're using energy to target the cells.
Exactly.
Okay, what about chemotherapy?
So chemotherapy,
I think that's probably the one everyone's most familiar with.
it's probably the most well-known.
Yeah.
So chemotherapy involves the use of drugs known as antineoplastics
Okay.
to kill or slow the growth of cancer cells.
Okay.
These drugs work by interfering with cell division,
Uh-huh.
and they're most effective against rapidly dividing cells,
Okay.
which is a hallmark of cancer.
Right.
However, because they circulate throughout the body,
Mm-hmm.
they can also affect other rapidly dividing normal cells,
Oh, right.
leading to some common side effects,
Okay.
such as bone marrow suppression,
Right.
which affects blood cell production,
Right.
gastrointestinal issues like nausea and vomiting,
Yeah.
hair loss,
Yeah.
and effects on reproductive cells.
Oh, okay.
A serious potential complication is extravasation,
Yeah.
where the chemotherapy drugs leak out of the vein into the surrounding tissues during infusion.
Yeah, I remember reading about that.
Yeah, and that can cause pain, swelling, and even tissue damage.
That sounds scary.
It can be a serious complication.
Yeah, what about biotherapy or immunotherapy?
So biotherapy or immunotherapy.
Yeah, that sounds like it uses the body's own resources.
That's exactly what it does.
Oh, okay.
It uses substances called biologic response modifiers, or BRMs,
Okay.
to stimulate the body's own immune system to recognize and attack cancer cells.
So instead of attacking the cancer cells directly,
Right.
we're boosting the immune system.
Empowering the body's own defenses.
Yeah, to fight it.
That's a great way to put it.
Okay.
So examples of BRMs include interferons, monoclonal antibodies, and interleukin-2.
Uh-huh.
And while side effects tend to be less severe than with chemotherapy,
Okay.
they can include flu-like symptoms,
Uh-huh.
and there's a risk of allergic reactions, including anaphylaxis.
So less severe, but still something to be aware of.
Absolutely.
Okay. And then photodynamic therapy.
So photodynamic therapy.
Yeah, I don't think I'd heard of that before.
It's not as widely known,
Yeah.
but it involves using a special drug called a photosensitizer
Okay.
that is activated by light.
Okay.
So the drug is administered to the patient,
Uh-huh.
and it's absorbed by cancer cells.
Okay.
Then a specific type of low-power laser light is directed at the cancerous area,
Uh-huh.
often using an endoscope for internal cancers,
Okay.
which activates the drug and leads to the destruction of the cancer cells.
So that's cool because it's really targeted.
It's a very targeted approach.
Yeah, just to those specific cells.
Right. It's been effective for cancers like esophageal and early-stage lung cancer.
Good.
And it has advantages like minimizing damage to healthy tissue,
Uh-huh.
often being performed on an outpatient basis,
Okay.
and generally causing less pain.
Right.
Side effects can include temporary swelling and some gastrointestinal discomfort.
Okay, what about hormone therapy?
So hormone therapy,
I always think of that as like menopause or male health issues.
yeah, we often associate hormones with those things.
Yeah.
But hormone therapy is actually used for cancers that rely on hormones to grow,
Okay.
such as some types of breast and prostate cancer.
Okay.
The goal is to block or lower the levels of these hormones in the body,
Right.
effectively starving the cancer cells.
Got it.
This can be achieved through surgical procedures.